Following months of a stalemate between the Kenyan government and the USA, the National AIDS Control Council has announced a breakthrough that will soon make antiretroviral drugs available to those living positively with HIV. This announcement came hours after demonstrations at the Ministry of Health headquarters protesting the lack of the invaluable drugs.
Having been caught in the crossfire for months, desperate and with no option left, people living positively with HIV and activists alike joined forces and headed to the Ministry of Health offices to protest the lack of antiretroviral drugs in the country.
It's a sad day in this country where people just meet in Parliament to discuss on our issues, but nobody is thinking about our conditions and our life.
Presently, 1.5 million Kenyans are living with HIV. 1.2 million are currently on long-term life-saving ARV drugs. The protesters say that the lack of medicine has left many vulnerable, including young children who depend on the drugs.
These ARVs mean a lot to me. I've lived because of these ARVs. They are my life. Without them, I can't survive. When I talk about my child, this child is someone I've given birth with HIV. Ever since the day the child was born, he was on medication. Now there is a shortage. The child, as you know, the children's immune system is very weak. So now without the drugs, obviously, that is like a death sentence to the child.
Mtoto anapatiangwa hizi dawa, hizi zote. So this is nevirapine, na ndio hakuna hata kidogo. Hata kidogo. Unaona? Ile kitu tumebakisha two empties. And it is very sad. It is very sad. Huh?
The shortage of ARV drugs was initially occasioned by a standoff after the drugs were blocked at entry in January as the KRA demanded 90 million shillings in tax, apparently because they were imported by a private company. Even though that was resolved, another issue arose as the USAID was against the ARV distribution through Kenya Medical Supplies Authority, demanding for alternative credible organizations.
What happened last year is our systems were exposed and there was a need for improvement. And out of the many audits that were undertaken, a reforms program was created. In the reforms program, we have our donor partners on board and they are supporting us. So they are with us in every step, and they've given us technical experts and other expertise to be able to enable us deliver this important exercise.
The National AIDS Control Council has since announced that through a multi-sectoral approach, resolutions have been made with US representatives that should clear the ARV drugs for distribution. However, it is still not clear when exactly the crucial drugs will reach the patients who need it urgently. Anita Nkonge, NTV.